Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice, Private Physicians Medical Associates, PPMA, with your host, registered dietitian and nutritionist, Meg Tancredi.
Hello, everyone, and welcome to the Nourish MD podcast, where we learn, grow, and nourish together. I am your host, registered dietitian Meg Tancredi, and today we have a very exciting episode for you all. We have Dr. Robert Lewis on the call today, and I am very excited. I don't want to talk about our topic just yet. I want to read your bio so everyone gets an idea of how terrific I think that your background is and what today is going to be about. So here we go. So Dr. Robert Lewis is the director of the Brain Tumor Program and the Empower 360 Endowed Chair for Skull Base and Minimally Invasive Neurosurgery at the Pickup Family Neurosciences Institute at Hoag Memorial Hospital. His expertise includes endoscopic and minimally invasive treatment of benign and malignant brain tumors and skull base tumors. Through the use of cutting-edge neuroimaging and neuronavigational equipment, he utilizes the concept of keyhole neurosurgery, minimizing the damage to surrounding brain, vascular, and soft tissue structures. Dr. Lewis has authored more than 75 publications and 10 book chapters and holds several patents for inventions in augmented reality for surgery. His specialty is in coordinating uses of advanced technologies in neurosciences across the patient care continuum. Welcome, Dr. Robert Lewis. Thank you so much for being here today.
Thanks for having me, Meg. I'm looking forward to it.
Yes, this is terrific. So I kind of there's a lot of information in that biography. And I want to break down a little bit of that before we dive into our big topic for today. So you, in here, it talks about augmented reality for surgery. I would love for you to enlighten all of us on what that is all about.
Yeah. So what it is, using the patient's own CT scan and MRI scan prior to surgery, we blend them together with a company called Surgical Theater, and we make a digital twin of the patient. That digital twin is then used in advance of the surgery in virtual reality to practice the operation in advance so that when I get to the operating room, I can do it right, when it really matters. So the ability to practice or rehearse the operation in advance in virtual reality allows us to do this same surgery on this particular patient. Even if I've done 1,000 of them before, I have not done this particular patient surgery before. So it allows us to simulate on this patient and do it as many times as we need to in order to get it right. Once we have the preoperative plan, then we take the same digital twin into the operating room, and the image is localized in 3D space and injected into my operating microscope so that I can see a heads-up display of the digital twin on top of the patient's anatomy that I'm seeing at the time of surgery. And that's a synchronization we call augmented reality, which is what the technology that I invented and developed along with Surgical Theater.
I mean, if that doesn't blow your mind, then I don't know what does, because it absolutely blows my mind. So, I mean, you clearly have to set aside time to practice and do all of that. So, I mean, is there a certain average number of hours you spend during the week practicing for the actual surgery? How does that all work, scheduling?
I guess it depends on the level of complexity of the case, but anywhere from a half an hour to an hour of simulation time. And that starts in the clinic where I not only do I do the simulation in the office, but I also show the patients their own digital twin so they can understand, like the model you see behind me, so they can understand the plan for surgery as well. And then again, the day of surgery, it's part of my kind of mental prep. Imagine, just before a basketball game, you see the players out there shooting free throws and shooting 3-pointers and warming themselves up. The same way I practice for surgery beforehand. So putting on the virtual reality, going through the planned surgery, making sure that I have a good mental map of where the important blood vessels and nerves and brain structures are so that I can do the operation through as minimally invasive approach as possible and preserve all of the patient's normal neurological function and their natural structures.
I mean, I think that is just so interesting. I mean, this is not mainstream, like this is not common for surgeons to do.
Becoming increasingly common. When we started, I've been doing this for more than 10 years. When we started doing it, with the augmented reality, we were the first place in the world to do it. The technology was developed here at Hoag, and then has been, since, brought across the world. It is still, though, a relatively uncommon way to do it. I would say, the top maybe 5% of centers are doing it this way. The places you would imagine, though, the highest level centers, the Mayo Clinic and Stanford and UCSF, NYU and this tier of care, and Hoag, at Hoag, we're proud to be among those.
I mean, it's just so incredible. It is so, I think, well, hopefully everyone can start getting more and more on board with all of this, because I think that is just.
The alternative is just the way, literally thinking about the operation. That's the way we used to do it. Like, okay, I'm going to do this, and then I'm going to make my cut here. And you kind of just walk through the mental plan in your mind, which has value, but it's, it's kind of ad lib as opposed to a specific plan and a specific simulation that's done on this specific patient's digital twin. Exactly.
Yes. So you compared, so when we first had our introductory chat, you compared surgery day, training for it, right? And I would like you to elaborate on that and tell everyone you compared training for a surgery, preparing for it. And you compared that to
an
Olympian athlete.
That's really how I view it, on a couple of different levels. Number one, that we call it the practice of medicine because we are practicing our craft on patients, and we hope to get better over time. But up until the advent of technologies like virtual reality for simulation, we had no way to practice except on real people with real consequences. Now, with the ability to simulate, we can practice in a specific setting. But more than that, it is the whole picture of imagining that, when people ask me, how long is an average surgery? Well, an average surgery is about 4 hours. Well, how long can, surgeries go? Well, the longest I've ever done is 23 hours. And it's not uncommon for surgeries to last 8 or 10 or 12 hours. And the most common thing that people ask is, how do you do that? And I say, I look at it like I'm training my body and my mind and my spirit and every aspect of me to perform at a level similar to an Olympic athlete competing at the highest level.
Yeah.
And, because the physical and mental demands, in my opinion, are the same, except the one thing that's even more is the consequences are more. Whether or not you win a gold medal is a big deal. Whether or not this person lives or dies or walks again or is able to talk to their family again, the consequences the stakes are as high as you can get. And so I take that very seriously. And it is my responsibility and, my life to prepare myself so that I'm physically and mentally able to do that.
And so tell me more about that. So you are preparing for surgery. So what does that entail in terms of your personal life, right? So how do you maintain the stamina for standing for 8 hours? I can't even imagine you said 22 hours was your long surgery. I don't even understand that. So let's start with the 8-hour surgery. How do you do that? Truly.
It is, a combination of mental and physical training and nutrition and optimizing, data signals, all in preparation for the main event. So, my program of wellness, the way I take care of myself, is very set and built around my needs to do that. I get up at 4:45 every morning. I wake up with the sunrise, a light alarm as opposed to a sound alarm. This is a more natural way to wake up. First thing that I do when I wake up in the morning is meditation. Then I do I drink a liter of water before I do anything else, before any coffee, before I do anything else. office. That is to kind of, looking after each system of my body. When we sleep, we're dehydrated. So we have to wake up and hydrate in the morning. We want to set our day with intention so that I start my day not by focusing on what pops up on my phone. That's someone else's agenda. I want to focus on my own agenda. And today, especially if it's a surgery day, my agenda is to prepare my mind and body for surgery. So, that's the first 30 minutes. And then it continues after that. By 5:30, I'm at the gym 6 days out of the week. And even what workouts I do are going to end up being tailored to whether it's a surgery day or a day in the office.
Right.
For example, on surgery days, I don't want to do a heavy weightlifting workout because even for surgeons with very steady hands, after lifting weights, because the large muscle groups are activated, the smaller muscle groups are kind of tremulous and they'll shake a little bit.
Right.
And so we don't want that. I do cardio on mornings of surgery so that my cardiovascular system and my endorphins and my cardiorespiratory system are primed, but that my muscles are calm and relaxed in order to prepare for a long surgery. In training for long surgeries, training my body, it involves timing of water. So I have a liter of water in the morning when I first wake up, which is 3 hours before surgery starts. But then I don't drink anything else until after the surgery is over. So this is, we have to balance that. Like I have to hydrate early because I know I don't want to have to go to the bathroom in the middle of a surgery.
Right.
And then afterwards hydrate again. It involves specifically training back and postural muscles so that I can stand or even, sit, and sometimes in awkward positions where I'm looking, at an angle or through a microscope, to make sure that I can maintain those positions with, and I'm strong enough to do it without my performance declining or seeing a decrement in the performance of my hands or my eyes or my head over the course of the long operation. It's a matter of, it's not physical strength. It's a matter of endurance from everything from postural muscles to eye muscles to the little tiny muscles in our hand, which are actually the ones doing the surgery.
Right. I mean, I think a lot of us have watched like the medical TV shows where we watch the brain surgery happening and it's a very intense moment and we're all holding our breaths. And that's probably as close to understanding or viewing how intense brain surgery can be. But like listening to you talk about the details of like, yeah, here's all the behind the scenes work that I have to do so I can be on top of my game the day of surgery for this person because the outcomes are huge, right?
And permanent. If I cut a nerve or a part of the brain, they don't regrow. Neurons don't regenerate in adults. So whatever structures I damage or during surgery, it could leave the patient with a permanent neurological problem.
Right.
The one thing I would say, as far as, you watching it, what you're doing is holding your breath. For me, having trained through this, the idea is to have a calm, steady breath, just like we do in meditation. You train, you meditate when you're calm so that you can stay calm, calm amidst the storm. So again, part of the whole process is training physically, but also training mentally to stay calm, even when something goes really wrong in the surgery. Because, let's say I accidentally cut the carotid artery, a hole in the carotid artery, which is catastrophic, bleeding, at a pace that we can't, even see what's going on. Right. If I start to panic and breathing fast or holding my breath, and I start barking orders at the OR staff, the ship is going to go down quickly. Yep. So my responsibility is to stay calm no matter what. Okay, everybody, we've got a hole in the carotid artery. I'm going to need everybody to pay attention. Can I have this? Could I please have this? If the calmer that I stay, the more likely I am going to be to solve that problem safely, quickly, with the purpose of my hands, as well as be able to communicate to the team that we've got this, I've got this under control, that I'm in command, and that, we all need to work together. If I'm panicked, everyone in the room is going to start to panic. So the sense of, learned, and that's not a natural thing for me. That's something that required skill, just like the Olympians do. you think that you go up you're at the top of a giant slalom and they're not nervous? Of course they're nervous. But you train it. I've been here 1,000 times before. I know how this is going to go. And if something comes up that I haven't experienced before, I know I can handle it. And when that carries over to the team, when you establish this thing called team flow, where it isn't just I'm in the zone of surgery, it's that the environment and the communication allows the team to stay in flow together. It isn't always perfect, but that is the goal, to stay in that calm, collected zone that we're all trying to accomplish the same thing for this patient together.
Get top quality supplements delivered to your door with PPMA's full script service. Personalized plans and easy ordering. Visit privatemds.com to learn more.
Yeah, absolutely. And you're 1,000% right. When you, the leader, are calm, it can kind of, reflect in everyone else and cascade, right? So when you have somebody who's panicked, you start to elevate also. And so you're able to kind of maintain that calm, cool, collected, facade, or not facade, but, feeling going on, which is really important to do. And when you talk about meditation, this makes me really happy to hear, because I want people to think about incorporating meditation or some sort of mindful practice in their life, because most people, if you live long enough, you go through some sort of crisis that does require you to have some sort of composure or calmness, or create the space where you can kind of go, okay, there's something going on right now, and you need to just, have a clearer mind to think about it. Right. And so when you talk about that, I'm like, yes, this is great. And I also love that you talked about hydration in the morning, because we're dehydrated when we wake up in the morning. So it's drink your water, have a little bit of, 5 minutes of meditation if you need to. We're not going into brain surgery, right? But if you can have a little bit of quiet to start your morning, rather than let me jump on my phone and quickly look at all this, stimulus out there and everything. That's not the best way to start your day. So I wanted to point that out to listeners, because I so appreciate that you brought that up, and that it really is important to pay attention to, even though they might seem small, just drink a glass of water, have 5 minutes of quiet time in the morning, but they really go a long way, especially when you are consistent with that every morning.
100%. With the water, it's always my reflex after learning this is, if I'm feeling fatigued in the afternoon, or if I have a headache, the first thing that I do is reach for a bottle of water, not a cup of coffee or a Tylenol, because usually dehydration is the first go-to. And I'm trying, I always try to get this to my daughter, that this is, try drinking water first, it'll get rid of your headache. And the other thing is that the meditation, the calm that comes with it. Yes, it's great to have the practice every morning where you're dedicating your time to yourself, but it carries over to so many other aspects of your life. And that's kind of the stuff I'm trying to pass on to my 13-year-old daughter at this point.
I love it.
And it helps me in the operating room. It helps me anywhere in life where it comes up, where something unexpected comes up. I can think of an example. we were in Africa last year and in Tanzania, and coming back, and there wasn't enough seats on the plane. And there was 6 of us, and there was only 5 seats on the plane. And so my buddy that's with me starts panicking. He's like, oh my God, what are we going to do? And I'm like, I take a deep breath. And before I say anything, my daughter says, don't worry, Uncle AJ, my dad's got this. And
that's cute.
To the guy, listen, there's something that can be done. And, and very quickly, I talked them into letting me sit in the cockpit of the plane and fly, with them from Africa, which is a kind of funny end. But the point is that, one breath, and there's nothing wrong is going to happen here. We've got this. And so the fact that my daughter is now recognizing that and is really a skill that I want to pass on to her, because in every situation, whether it's brain surgery or some travel mishap or an exam, it's always going to help you to take even one deep breath before you do anything else.
Yes.
And that's the kind of message with that I think everyone, like you said, everyone can benefit.
Absolutely. Absolutely. Yeah. And when you practice that, I mean, you really start to notice, oh, wow, my nervous system is a little bit more calm. I'm not as quick to react and make maybe more of an impulsive judgment, right? Or your emotions are a little bit more composed. So you just keep practicing that over time, because I'll tell you, long ago, I did miss a plane and I noticed I did not take a breath. I was like, oh. And so fast forward time where I've gone through a similar situation, I'm like, oh, yeah, you practice doing these little bits of nervous system regulation and it actually works. So it's really encouraging, when you do the practice over time and then you see it reflected in your life. Okay.
Especially when it goes from like, almost at this point, it's like something I kind of enjoy as part of the journey. Like, you know what? I got this.
Right.
All good. It carries over to parenting. Like, never, even if I'm upset with Ami, my daughter, for something that she's done, it's never going to help for me to yell at her. Like it's never going to help the situation for me to go into it. Like it's always going to be, okay, I understand, this is what happened. How can we solve this?
There you go.
One breath, sometimes 30 seconds, that makes a difference.
Yes, exactly. And if you need to go on a 5-minute walk, that's perfectly fine too.
Yeah.
So I want to ask you a little bit more. Can we talk about the 22-hour surgery?
Yeah.
I'm curious. So, I mean, during that, do you just become so hyper-focused that like you're not hungry or thirsty or you notice anything else? Or do you get really fatigued at some point? Or like, I got to just power through this? How do you feel during all that?
So definitely don't get hungry. You're dialed in, you definitely don't get hungry or really thirsty. Although, that many hours in, the dehydration will start to cause headaches, over time.
Yeah.
I do over surgery, several hours or more long, you do have to scrub out and use the restroom, which we can do. It's fine. The two things that kind of, over longer cases like that start to add up are eye strain, eye fatigue, like your eyes, because you're blinking way less. You're working under a microscope, blinking a lot less. So my eyes get dry. So that, I'll have to scrub out and just kind of blink my eyes or wash some water in them. And my back, even though I train it all the time, there'll be times where I'm laying flat on the floor in the OR for a few minutes just to stretch my back out. People are laughing, like, listen, I need to just flatten it out to reset. And again, I'm meditating during that time as well. Like, okay, this is a good time for me to take a break. And one of the things I do is during the part of the operation at the beginning, there's something called a timeout where it's like our initial communication. This is what we're doing. This is the patient with the problem, these problems. These are the parts of the case that I might be concerned about. And one of the things I always say is, this is a very difficult case. If anyone in the room feels that I need a break, I empower the staff to tell me, Dr. Lewis, I think maybe you need a break right now. Why don't you take 5 minutes and just take a rest? Because sometimes I may be so focused, like, that I'm not realizing that I'm getting tired. So I empower my team to let me know that. And sometimes like, you know what, that's a great idea. And I'll just like lay flat on the ground, Shavasana in the OR.
That's great.
And it works. I go back and I'm able to solve a problem that I might have been struggling to solve.
Okay. Wow. I almost feel like a little bit of exhaustion right now, just thinking about like having to be, because it's not just standing. I mean, you are like rounding yourself and, focused on one little tiny part in your hand. And I'm just thinking about that going, oh my gosh, so I applaud you guys out there. I mean, that is very intense work.
The interesting part is that, it is not nearly as mentally challenging as people would think. Like, in fact, a lot of the time, I would say most of the time, surgery is almost itself meditative. If you imagine that you like to paint or draw or do pottery or do something where you kind of get in the zone of doing it, it is very much that way most of the time when you're really focused and if you love doing it. And so the mental energy, I mean, for very long cases, it's one thing, but like for most surgery, I leave the end of an OR day mentally feeling either, neutral or energized. By comparison, the mental energy required for clinic days, seeing patients in the office, sometimes very sick patients, or delivering difficult news, requires much more mental, emotional energy than surgery does. Because surgery is, I'm doing one thing, I'm focused on it. Everyone in the room is helping me do that thing. There's no emotion to it. The thought process is it's mechanical and problem solving, but not, I have to tell this mom that, her kid is sick or that her husband is dying. That I leave those days sometimes very mentally drained, and those are the things that require the other parts of my life to fill my cup up, so that I can keep
going.
Going.
Right. Yeah. You know what? I didn't think about it like that, but yeah, thank you for explaining that. But yeah, that makes a lot of sense. The emotional side of things can absolutely be exhausting when you're like, I didn't just run a marathon. I had to deliver bad news. I had to be present. I had to, validate how the other person is feeling and everything that goes into that conversation. Even if it's like a 15-minute conversation, that can still feel very tiring. So yeah. That's a very good point.
And sometimes, there's nothing that we can do as surgeons. And so, that's hard too, being like, listen, I've done everything I can. I don't have surgical options. And in those cases, it's just a matter of being there for them as a human being, and as a physician, not necessarily as a surgeon. Like you said, listening to them and just letting them know you understand how hard it is, and that you're there for them, even though there's nothing else with my hands I can do.
Right. Wow. Hopefully you don't have to have those conversations too often. And
yeah, each one is a lot, but I do a lot, a lot of the tumors I do are non-cancerous or benign tumors. So even though the surgeries are difficult, if the surgery goes well, the outcomes are often excellent.
Okay, good. Well, is there, I meant to ask you this earlier, but is there, you mentioned pituitary. Is there anything that is pretty common as far as the surgery goes, like a part of the brain that you're operating on, or is it just a mixed bag every time?
It's generally a mix. As a minimally invasive skull-based surgeon, a lot of the tumors that I do are the ones that are located on the kind of bottom half of the head or the brain. So you have the top of the head, which is called the calvarium, and the bottom of the head, which is called the skull base. And the skull base is where the brainstem is, where the nerves that control your vision and your hearing and your balance and your taste and smell, as well as the arteries that feed it all, are located. And so in the skull base, which is where a lot of my surgeries are done, the tumors tend to be non-cancerous, but the structures involved are critical. And so it's often, more difficult surgery with a better prognosis if I can get the surgery done well and get the whole tumor out. So, the tumors wrapped around the optic nerves, for example, I have one of those later on today. Those ones, those kind of things are what I specialize in most. Of course, certainly I do tumors on the top of the head as well, and they can occur anywhere in the brain. Brain tumors are generally one end of the spectrum or another. They're either benign, meaning if we get it out, we can cure them, or glioblastoma, which is the most common, malignant type of brain tumor, is, almost universally fatal. And so that's where clinical trials and other things come in, beyond the surgery. And that's where our team does a fantastic job taking care of those patients.
Wow. Okay. You have a very, very complex, you are in a very complex position. That is,
but I love what I do. Like I said, it doesn't feel like a strain. And over time, the more I optimize my body and mind to do it, it's actually, as I'm getting older, I feel like it's getting to be less of a strain. Obviously that comes with, I've been in practice for 13 years now. So it comes with the experience with time, but also my self-care regimen, the diet. We haven't talked about diet,
Hey, we can talk about diet for an hour if you want.
to fuel my body, to make it, perform optimally. And again, it's based on what I'm doing that day. I'm a big fan of using data. I wear the Oura Ring. I wear a glucose monitor. I'm not diabetic, but I wear the, Apple Watch. All of this stuff gives me data that I use. I have a body composition scale at home, which, I'm measuring my body composition.
Nice.
I'm tracking all of this stuff and tracking how it affects my performance in surgery and in life.
Okay, so you opened up a door and you said, a glucose monitor, which I'm a huge fan of, whether you are diabetic or not. I've worn a CGM a few times, and I think it's really important to listen to the feedback and actually see what's going on in your body, as opposed to, waiting for symptoms to arrive and knock at your door. When did you start wearing a CGM? When did you get into that?
So probably about 2 years ago, and when I got the Oura Ring, and then it just popped up like, yeah, you can get a CGM with this, and I was like, yeah, let me try that, and I love the data because you get feedback of what I ate made this kind of difference, and you learn specifically I already know the science about what should make a difference and not, but in my own body, it's like I can experiment with it all the time and see what happened to my glucose? How did I feel that afterwards? How did I feel the next day? How close to dinner time, bedtime can I really eat? And how did my workout go? And all of that is kind of, the more you can put in the data, then you can learn to optimize, or I learned to optimize my diet along with everything else to perform at my best. Using the data from the CGM to optimize my diet in preparation for surgery, in preparation for certain workouts. I am a fan of 16-hour fasting, so with some exceptions, I definitely ascribe to the value of metabolic switching, to getting myself into or close to ketone metabolism. I have a ketone monitor as well, a fingerprint monitor, which, if I'm trying to push that envelope at certain times, that I'll monitor that. I feel that when I do that, I don't feel great. I can't tolerate being in the ketone metabolism for long.
Yeah.
But I definitely feel best and have sustained mental energy when I don't eat at all. I don't eat at all before surgery. So I have my water in the morning, liter before my workout, another 500 cc's afterwards, but plenty of time before surgery. I do drink Celsius, so I like I have my caffeine before the workout as well, but I don't eat ever before surgery. I always explain it as, a lion doesn't hunt when they've already eaten. And so I'm in the OR, I'm hunting. I need to be dialed in, eyes focused, what one thing to accomplish. If I've got a big full belly and I'm kind of, I need to rest.
Oh, no.
Actually understand what I'm doing. Yeah.
Oh, wow. So on that note, if you're not eating prior to surgery, and then let's say you have like a 14-hour surgery or a 20-hour surgery, have you noticed your blood sugar, tank, or does it stay right?
No, it stays good, actually. In fact, when I eat, it starts the clock to fatigue. So if let's say I have breakfasts, somebody's visiting and I go out to breakfast for some business meeting, and then by lunch I'm really hungry. Okay. And then if I eat lunch, then the afternoon a salad won't do that, but most other things will.
Right.
If I don't eat at all in the morning, and then I only eat I start eating at noontime, I have plenty of mental energy all day long. And the same thing, I don't ever run out of mental energy if I haven't eaten. It's that when I eat, especially if there's carbohydrates involved, of course, a salad with protein doesn't do it, but if there's carbohydrates involved. So I generally spare or save my carbohydrate meals for later in the day, which isn't optimal before bedtime, but it's the only really way I can do it with my schedule.
Yeah.
Because the important factor for me is the mental energy.
Absolutely. Yeah,
And
absolutely.
it doesn't have to be a burst of energy. It's sustained level where I'm not going up and down.
Yeah, exactly. Okay, so for anyone listening, this does not mean you jump into, 16-hour fast and we're waiting until noon. It's, something that I'm assuming you like worked into. And like you said, like it's what works with your schedule, and you've clocked in. What I really appreciate is that like you've connected the dots between like blood sugar and like all the data, how you're feeling mentally, what your energy is like over the course of the day, how your sleep is. I'm sure you've like worked on that because that's like absolutely imperative. So, I mean, all of these things go together. And so I always, when I talk with people that I work with, when it comes to nutrition and just, lifestyle in general, it's that awareness piece, right? It's like tuning into your body, tuning into your soul. Like, how do I feel? Like maybe on the day to day, but also just like in general too, right? Like, do you have joy in your life? Are you generally happy? Like, do you have connection? Are you a calmer person? What are your eating habits and the timing? Like all of this stuff, like really impacts how you feel regularly.
Yeah.
So I love that you like have talked all about this, because initially, right before I met you, I thought, well, we could talk about all sorts of things related to just specifically, brain surgery, right? Which is interesting. But, you've brought up all these other aspects that I think are very relevant to anyone who is listening, very relevant to kind of optimizing, just improving your life and really feeling good, right? Talk to me a little bit about your sleep.
Yeah. Again, something I prioritize. Now, there are times when I'm on call, and if I'm on call, my sleep gets interrupted. I have to, answer the phone, and whatever time it comes in the day or night, I have to answer it, and sometimes go in for emergency surgery. But I mean, I prioritize sleep as a key component of my overall tuning my body to be able to perform these operations and to continue to do that. I go to bed somewhere around 8:30. I, wake up, like I said, around 4:45. My average sleep, according to my Oura Ring, I get usually like 6 hours, 6.5 hours or 7 hours a night, which is good for me. I can't really sleep much beyond 5:30, even if in the morning, even if I tried. I have an early morning, chronotype. It's funny because I used to make fun. I remember being a kid, and I would make fun of my dad, like 8 o'clock, he turned into a pumpkin. I'm like, Dad, you're turning into a pumpkin. It's 8 o'clock, I'm like, what's wrong with you? And I would be fumbling for it. And sure enough now, like I wake up in the morning and I'm ready to go, and I'm all day long, but around 8 o'clock, I'm like,
you're like,
power down.
Yeah. Yeah.
I go to bed before my teenage daughter, and I'm like, okay, honey, I'm going to bed. She's like, okay, Dad,
Yeah.
I make sure my room is cold and dark.
There you go.
I don't, one of the things I've learned definitely over time is not, unless I'm on call, not to check my phone. I put the light on the phone on the lowest possible setting. So if it goes off at night, it's very dim. It's hard to explain to people how the light in the phones is like a sunlight, and few seconds of that. I don't have a clock. So I don't check what time it is. And that's one thing I learned specifically. Like I would sleep okay, but then I'd wake up and, I'd look at the time, and then, it would take a little while to fall back to sleep. If I wake up to go to the bathroom, doesn't matter what time it is.
Right.
I go back to sleep, and I fall asleep much more easily when I'm not worried about what time it is. But I prioritize
saying this.
What's that?
I'm so happy you're saying this.
It matters. And then, if the Oura, my data is telling me that I have a sleep debt, even though I feel normal, I do my best to go to bed earlier. I'll go to bed at 7:30 to make up for, a sleep debt if it's there. Yeah. And I notice that. I look at all of this stuff, sleep and meditation and nutrition and physical training. And, I look at for me, yes, I want to live a long, healthy life, but also I owe it to my patients to have the machine that is operating on them be as finely tuned as it can to give them the best outcome. There's no objective data for this, like, well, I have a lower complication rate when but I know that it's true. I mean, there's no way all of this stuff adds up sequentially over time, one patient at a time. And, all of this, the things that I do to tune myself to be in the best possible shape to help them. Because what I do is very serious. People die and complications happen. And, there's a book by a neurosurgeon, Henry Marsh, called Do No Harm. Most books by neurosurgeons are very much, like Ben Carson's book, Gifted Hands. Who writes a book about themselves called Gifted Hands? I mean, I think it's a little bit presumptuous. So most books by neurosurgeons are very much that way. I'm great. Everybody should bow to me. I think that's crazy. Henry Marsh's book is the opposite. It's like, people die in our hands, and sometimes because of what we have done. And how do we live with ourselves? How do we carry on and carry the weight of this? And for me, the answer to that is in knowing that every day I'm showing up and giving the best that I can to this patient. I have prepared myself. I don't drink alcohol at all. I obviously don't smoke cigarettes. I don't do any harmful things. And then I do everything I possibly can to prepare my mind and body to perform the task that is necessary for me today.
I think that is absolutely phenomenal. I think we're gonna end on that note. I think this was absolutely, inspiring for people to hear. I will speak for everyone. I think this was informative and really interesting. And I so appreciate all your, perspectives and your, the inside scoop on what it's like to be in your shoes. And my hat goes off to you when you have those really long surgeries and you have to go lay on the floor and and unwind a little bit. But thank you so much, Dr. Lewis, for being here. This was absolutely amazing. Do you want to impart any wisdom or any other, advice on our listeners or anything like that before we call it a day?
No, just take care of your body and your mind. You only get one shot at it.
100%. There we go. We get one shot. That's right. Well, thank you so much for being here. Okay.
I enjoyed it.
Thank you. And everyone, thank you so much for tuning in to Nourish MD podcast. You can find us on Spotify, and we'll see you next time. Take care.
Thank you for joining us for today's episode of Nourish MD, Dr. Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.